Ulcers are open wounds that can be difficult to heal, but through hyperbaric oxygen treatment at the John C. Harris Wound Healing Center in Clovis, patients can speed up that healing process. Antonina Cardinali was experiencing flu-like symptoms for weeks when she noticed a mysterious spot near her ankle that was sore to the touch. Hoping to get answers, she drove herself to the hospital.
And so they admitted me, and then it started with a small bruise that was about the size of a dime near my ankle, and it quickly expanded.
While at Clovis Community, Antonina underwent a series of tests and was initially diagnosed with a severe case of pneumonia. And as more test results came in, her doctors discovered her pneumonia was spreading.
She developed a wound on the foot and managing it, and then suddenly she developed this fungal type infection that spread from her lungs into her spine.
Podiatrist Emmy Ohi was called in to be part of Antonina's care team. The wound on her foot had reappeared and was beginning to grow rapidly.
Obviously, when you have such an extensive wound, it's a team approach, multi-team approach, where you get infectious disease on board.
Antonina had to undergo additional procedures to control the infection. Once under control, she was referred to the John C. Harris Wound Healing Center to treat the wound on her foot.
The simplest way is think of hyperbaric. It just infuses your blood with 100% oxygen.
In a hyperbaric oxygen therapy chamber, air pressure is increased 2 to 3 times higher than normal. Under these conditions, the lungs gather more oxygen, helping the body fight bacteria and promote healing.
We see diabetic foot wounds, we see lower extremity venous stasis ulcers, we see pressure injuries.
Hyperbaric's supervisor, Brian Chandler, worked with Antonina to calm her nerves and anxiety. These are common feelings for patients during their first treatment.
I have claustrophobia, so when I first saw that, I was like freaking out that they were going to shut me in there and they're going to close that hatch.
Antonina says Brian and the wound team put her mind at ease so she could continue her treatment.
I actually got anxiety meds from my doctor, and stuff, but I only used them for the first couple of days, and that was it. And
I'm quite pleased. I'm not, this pendulum has swung to the other direction where I think, okay, you're doing really well.
Antonina says Dr. Ohi and the wound team at Clovis helped her both physically and mentally as well. And for that, she says she will be forever grateful.
I like seeing that progress, and it's like, with every little step of progress, it gives you more incentive, to keep going.